Hi, I am Dr. Raman Kant Aggarwal, Vice Chairman, Institute of Musculoskeletal Disorders and Orthopaedics in Medanta, the Medicity. Today we are going to talk about arthritis because it's important as its incidence is rising. Arthritis is an inflamed joint. Inflammation because of any reason. When the joint becomes swollen, sometimes hot, tender with restricted range of movements, and that is arthritis. The symptoms will be pain, restricted movement. These are the two main symptoms of arthritis, and this pain could be of many types, can happen in the night at the activities. When it happens in the night, we call it the rest pain, and which usually indicates an extreme form of arthritis. There are many types of arthritis, the most common being the routine degenerative routine wear and tear, because we are walking on the joints, we are using the joints, and the cartilage which has been present at birth in our body does not regenerate. There is a fixed number, and this cartilage usually keeps on wearing down, and that's we call the osteoarthritis, which is the degenerative osteoarthritis. Then comes the inflammatory arthritis, like because of autoimmune diseases like rheumatoid arthritis, ankylosing spondylitis and psoriasis. These are the three main inflammatory arthritis. But then arthritis can also happen because of injuries, trauma, and it can also happen because of infection. Usually these are the four more common types of arthritis. You will be surprised to know that in children we can get arthritis because of infections. They are very common. As we grow, then because of injuries, and when we go beyond 40-50 years of age, then rheumatic disorders, autoimmune disorders and degenerative disorders predominate. So all ages can be affected, but mostly elderly people are affected beyond 50 years of age. There are many ways of diagnosing arthritis, the simplest being the X-rays. And then there are MRIs. When we can't see much arthritis in the X-rays and we suspect arthritis, we can get an MRI done. But X-rays and MRI constitute the radiological imaging part of the arthritis. But the arthritis because of autoimmune disorders like rheumatoid arthritis, ankylosing spondylitis, psoriasis can be diagnosed with blood tests. The treatment of arthritis will actually depend on the stage. In the early stages, when there are minimal signs on the X-rays, and the symptoms are also not that severe, and then which joint is having arthritis will mainly dictate us in the form of treatment. For example, in the lower limb arthritis in the knee and hip regions, controlling your weight so that don't become overweight, maintaining the nutrition of the joint by good mobility exercises, maintaining the nutrition of bone with vitamin D and calcium, and maintaining the strength in the muscles. These four things will constitute the major treatment of arthritis, with some rest, cold packs and some anti-inflammatory medication. However, there are certain postures which can be damaging for the lower limb arthritis, lower limb joints, and for that you need to avoid certain postures or wrong exercises. While in severe form arthritis, as I said earlier, the unfortunate part is the cartilage, which actually is a part of the end of the bone which forms the joint. It does not have any blood supply and does not regenerate. So there is no question of healing in arthritis. There is question of preventing the arthritis, which is autoimmune disorder arthritis, inflammatory arthritis, which can be prevented by taking proper medications in consultation with the rheumatologist. In degenerative arthritis, once it sets in, you can only control the progress of the arthritis by not overloading the joint. So there comes the role of avoiding an overweight situation or overloading the joint. But this is the only thing. Otherwise, it is impossible to prevent the arthritis. My message is that arthritis is a crippling disorder, and it produces night pain, rest pain, and definitely pain on activities. There are effective treatments available for arthritis of each and every single joint, and my message would be not to suffer in pain and silence. Consult early so that you could prevent if it is possible, or get a definitive treatment and you could live a pain-free life.